This patient was referred to me for endodontic retreatment of tooth number 19. I mean, look at this. You can't even call it a root canal. Terrible. Look at the crown and all. Just terrible. I mean, look at it. It's just terrible. Retreatment of tooth number 19, and he had pain associated with the tooth, and you can see a periapical lucency there. And tooth number 18, root canal. And this is tooth number 18. Tooth number 18 had received a composite restoration 2 years prior, and tooth hurt to everything. And according to the patient, I found the tooth to be percussion palpation tender. Probings were 2 to 4 millimeters, and you can see a periapical lucency. So this was a necrotic tooth. Look at tooth number 19, and I was hoping that this was the root anatomy of the distal root, but in reality it wasn't. And you can see that this is not part of the distal root. This is just normal bone anatomy superimposed on the distal root, giving the impression that this is part of the distal root, but in reality it wasn't. And I'll show it to you. So we went over options with the patient. The patient has dental phobia, claustrophobia, and severe gag reflex. So we talked about IV sedation, of course, with doing root canal on tooth number 18, redoing the root canal on tooth number 19, or extract those teeth. And patient said that he wanted to try to save them. So today we IV sedated them and did both of these treatments in one visit. And here's the post-op. As you can see, everything went beautifully. Look at tooth number 18, 3 canal systems, proximity to inferior alveolar nerve canal. You need to be really careful with these. And look at tooth number 19. The dentist who had done the root canal had missed 2 canals. I mean, the root canal was terrible to begin with, but he also had missed 2 canals. The middle mesial canal he had missed, and a distal buccal canal he had missed. And of course, he wasn't patent at all. These were 25 millimeter long roots. And as you can see, everything went beautifully. I was able to regain patency in all 5 canals and 3 canals here. And as I said, this is not part of the distal root anatomy. Distal root ends right there, and you can see I have a sealer puff right there. And look at the mesial roots. Looks like all 3 join, and there's a sealer puff right there. Everything went beautifully. We temporized the tooth and referred the patient back to his dentist for the permanent restoration. And again, look at this PA, and you can see that the apical end terminus is right there. This is part of the normal bone anatomy superimposed on the distal root. And again, this x-ray confirms that.